Today we're going to show you how to set up a Foley catheter tray. Jenna and Yvette are here to help us with the demonstration. Before we move forward, we will check the order. Verifying the orders is important because it ensures that we're providing the right treatment to the right patient. So today we have Mrs. P. She recently underwent bladder surgery and was ordered a Foley catheter. We checked the doctor's order and made sure it was accurate. It is also important to review the patient's medical record to identify any issues that may affect the procedure. The prescriber will choose a catheter based on various factors, such as the patient's medical history, allergies like latex, history of catheter incrustation, and susceptibility to infection. They'll also consider the expected time required for catheterization. Based on Mrs. P's medical history, we now know that she has no known allergies to latex, rubber products, antiseptic solutions, water-based lubricants, or tape for an indwelling catheter. She has never had a catheterization done before and has no pathological condition that may impair the passage of the catheter. The prescriber has ordered short-term catheterization for post-operative care. Nurse will introduce themselves as a student nurse and provide the patient privacy. Nurses play a critical role in preventing and treating UTIs by implementing infection control principles. This includes practices such as hand hygiene, properly disinfecting equipment, and using sterile techniques during procedures. So, Yvette will be performing hand hygiene. Next, the nurse will identify the correct patient using the 3 patient identifiers: full name, date of birth, or medical record number. We will explain to Mrs. P that her doctor ordered a Foley catheter. Hi, Mrs. P. Today we will be inserting a Foley catheter, which will help in carrying urine out of your body into a collection bag. We will get you laying in a comfortable position on your back with your legs apart. This will allow us to clean the insertion site with an antiseptic solution. You should not feel any pain during this procedure, only a slight irritation. If you do feel pain, please let us know. We will use a bladder scanner to measure the volume of urine in Mrs. P's bladder before insertion. We also want to make sure that we have all the necessary items in the kit. This includes an indwelling catheterization tray. This tray carries your cleansing medium, either pre-moistened, swab sticks or sterile cotton balls, sterile forceps and antiseptic solution, a water-soluble lubricant, the catheter, and a pre-filled syringe, with which you will use to inflate the balloon. Remove the outer wrapping of the catheterization kit. Place the tray from the inner wrapped catheter kit on a clean surface, such as the bedside table, or if possible, between the patient's open legs. The patient's size and positioning will dictate its placement. You will create a sterile field from a pre-packaged kit, and all the supplies you'll need are in the sterile tray within the kit. The appropriate size for an adult female is 10 to 12 French. Raise the bed to a comfortable working height and lower the rail on the working side. Okay, Mrs. P, I'm going to lower the head of the bed just a little bit. I'm going to go ahead and pull your covers back, and I will drape you with the blanket. Drape the patient for privacy, and ensure that there is a waterproof pad under her. Help her into the dorsal recumbent position, lying on her back with her knees flexed. If you could bend your knees up and spread your legs apart and relax your thighs. Cover the patient's upper body with a blanket and drape her lower body with a separate sheet or bath blanket, exposing only the perineum.
I take off my gloves, make sure there's a trash can on the ground, and perform hand hygiene.
Pick up the square drape and let it unfold without touching any unsterile surface. Form a cuff by letting the top edge of the drape fall over both your hands. Then place the drape, shiny side down, on the bed between the patient's thighs. Slip the edge just underneath her buttocks and ask her lift her hips up. To maintain the sterile field, take care to only touch the 1-inch edge